Dr. Raj Dasgupta, the man who makes sleep so fascinating.
I think I'm just a normal dude.
Pulmonary specialist and assistant professor of clinical medicine.
I'm a quadruple board certified doctor here at USC.
I recently caught up with Dr. Raj
to explain the condition and to separate fact from fiction.
for Sleep Awareness Week.
You're hot right now.
Thank you very much.
Dr. Raj, the most interesting pulmonologist in the world.
Being the good doctor isn't explaining it in complicated words, but explaining it in a language that everyone can understand. When we talk about sleep paralysis, it's kind of bookshelf between two disorders. On one, sleep paralysis, there's a disconnect with the brain and the body. You're awake, but you can't move. It's scary. But on the other side, there are disorders where you're sleeping, but you know what? You could actually move your limbs.
She's been paralyzed from even getting on an airplane.
Our body thinks we're gonna have REM at certain parts of the night, but when you're traveling to London and Milan, well, your REM sleep's gonna jump all over the place. It's very important to make sure that either your kit contains lidocaine, if not, to ask your nurse or staff to provide you with some lidocaine for safe, painless placement of the catheter. I saw the video, I'm sure the whole world has seen the video. It's that combination of being dehydrated, and I'll tell you what, if I had pneumonia, I wouldn't have any appetite, you know? You're just not eating and hydrating yourself well. So I think any good doctor worth his salt or her salt would say, rest, eat, drink.
You all like naps.
No, Larry, that's a very spicy thing to say.
You don't like naps.
If you have insomnia, the worst thing you can do is napping. Why? It takes away your drive to sleep at night. But if we're talking about being sleep deprived, we're talking about a disease called narcolepsy, nap all you want, I'll write you a letter.
When we talk about Hollywood, they usually this movie about narcolepsy that exaggerates it, making someone with cataplexy have their head fall into a cereal bowl with their Lucky Charms falling all over the place. But that's not what cataplexy is. It can be very subtle. I make sure my patients understand every drug, every test I ordered, and you know what? Why did I order it to begin with? The biopsy showed findings consistent with methotrexate. And when we talk about methotrexate, which is the cornerstone for rheumatoid arthritis, one of the known side effects is going to be lung toxicity. That is the inflammation. Your lungs were extremely sensitive to that drug, causing that scarring.
I think you really have to be schooled by your doctor.
We're getting some pulmonary function tests today to see how those lungs are doing. It's amazing.
Yay!
I'm a sleepwalker.
You are? And how many times are you waking up throughout the night?
Like 3 to 10 times.
Wait, 10 times? Napping, are you doing it?
No.
The discovery is she is profoundly sleep deprived. Waking up 10 times per night? I can't even imagine what the mathematics is for that. You need to nap. Traditionally, the word pulmonary embolism means a clot. And using doctor talk, that means a thrombus.
Okay.
And where do these thrombuses come from? The lower extremities, the pelvic and our legs, the deep veins in our legs. And that's why I use the word deep vein thrombosis. Who is going to be predisposed? Is it a certain race? Is it a certain gender? And that's a big question. And just because we know the genetics behind it, which we don't just yet, are there triggers? The screw. It's not smooth like a coin. It's very, very sharp. And because he aspirated that, or said went into the lungs, is that not only can there be damage going in, but damage when you're taken out. We had to take out the breathing tube that he needs to breathe while holding on to the screw. And when it comes back, we had to put the tube back in because he's still paralyzed. But the good news is that he did great, a little embarrassed, but look at all you have to go through by putting that screw in the mouth. If you or a loved one are concerned about having a brain AVM, please consult your local neurologist or go to my website. You gotta know what you're looking for.
Oh, you're so good to us.
24 karat magic in the